there is this integrated medical diagnosis as well. Now, in the old days, say about 30 years ago, if you went to a doctor, the doctor will ask you to stick your tongue out. The doctor will look at the eyes. The doctor will look at feel the pulse. Now today, all that is not used, not even taught in medical colleges. So this art is being pushed aside by technological advances. But I must say one thing. The object of labor of a physician or doctor is a human being. You cannot underestimate the power of the human being. You should not treat it like a machine. So doctors should observe and watch the telltale signs that appear in various parts of the body. So you use the tongue. The tongue diagnosis has been used for thousands of years. So you study the tongue. What can you tell from the tongue? You can tell whether a person is constipated, whether a person has diarrhea, has too much yeast in the gut, the liver is malfunctioning, is producing a lot of acid, eating a lot of carbohydrates, is having problems with heavy candidiasis, having problems with fungal infections. So you can tell a lot of things by looking at the tongue. And the iris, amazing thing. If you study the iris, it's quite fascinating. You may have heard of some acupressure diagnosis on the feet or on the hands. So by pressing on certain points, many of these practitioners of reflexology can actually diagnose some of the conditions. I'm not saying that it should be taken very, very seriously. You should combine it with other methods of diagnosis. But you can tell. So the iris, being a part of the nervous system, absorbs all the information that you have had. Inflammation of the body, fractures of body, and surgeries on the body, and various types of disturbances. So they are reflected on the iris. It's amazing, but I must tell you that, having done so many iridological diagnoses, that there is a link between the two, and it's true. Then I look at the ears, I look at the nails, because the nails grow, and as they grow, they pick up information of various things happening in the body. And then I do the face diagnosis. Looking at the face, the color of the face, you can tell whether a person sleeps well or not, whether a person is got some inflammatory disease, some skin problems, dandruff. And so looking at the skin, skin is a large excretory organ. What goes on inside is reflected on the skin. So we must study the skin. It's a very important thing. Then of course the pulse. No, we as doctors know only the pulse to read the rate of the pulse. So nowadays you have a machine, you put your finger in it and it's recording your pulse rate. But in the old days, and I've been able to teach many of the doctors that I've trained, you could tell so many different things. You could tell whether the woman is pregnant or not, whether the woman is having periods or not, whether there is pain in the body, there's fever in the body, there's a sort of a problem of the colon, a problem of the kidneys, of the liver. And I must say, it is a fantastic method of diagnosis. It may look very silly. I know it is subjective. It's your own analysis. But an experienced doctor will know what he's looking for. The pulse alters all the time, with your emotions. So how can it not reflect the things that are going on inside the body? So the pulse diagnosis is also one of those powerful diagnoses I use. And I've been able to, not that I'm going to say no to modern medical diagnosis, looking at scans and x-rays and blood tests, and that's where integrated medicine comes into force. But I will use the traditional medicine to create a rapport. Say, for example, if I tell the patient that, look, you have had fracture of the femur, or you've got gallstones, or you've got kidney stones, or you've got a stomach ulcer, or your breast had a surgery because of mastitis, or you've got a frozen shoulder, the patient will automatically pay a lot of attention to what you're saying, because it almost sounds like fortune telling, but in actual fact you're reading the telltale signs on the body to tell the person what is wrong with him or her. And this also helps the physician to understand, because when a patient comes to the consultation, he or she says, oh, I've got gallstones, I've got rheumatoid arthritis, I've got this, that and the other, based on what other doctors have told them or what other doctors have diagnosed. Where is the physician's role? The person that is looking at you, the educated medical physician. So we start from the beginning. We tell you what's wrong with you and we cross-check. You know, we're not God, but we cross-check, we make mistakes. But if the iris, the tongue, the ear, the nails and the face diagnosis and the pulse point out to a particular organ, let's say the stomach or the colon, and say that something is wrong, then it must be true, because so many different modalities of diagnosis are saying the same thing. So then you can't rely on just one diagnosis unless, one type of diagnosis unless it's so clear. So this is how I have used this method of diagnosis, and I've taught these doctors, and many of them are practicing it, and it's a fantastic way of running a consultation away from the computer screen, I'm afraid. You know, look at the person, look at what they look like, you know, whether they're happy, they're sad, they're sleeping, they're smiling, or very tired and sad and almost falling asleep and look dazed. Oh, there's a difference. So there you are.